Good afternoon, everybody. A lot of information today, so we'll get to it. Unfortunately, we lost 4 residents in the community yesterday. 2 hospital residents, female 62, male 77, and we lost 2 individuals in nursing homes as well. So certainly a tough day related to loss of life, and we want to think of the families and think of everybody here, keep them in our prayers as the toll of the pandemic continues. Now we've lost 611 people since the pandemic started in our county on March 16th of last year. Our positive rate continues to go in the right direction. 2.5% is our 7-day average. Our daily average is under 2% today. I think it's 1.7%. So we continue to go the right direction as far as new cases go. Overall, we've now had 29,648 cases. That's 74 new cases. That number's low, and today's Thursday. So that's good. Our Thursday, Friday, Saturdays are larger tests come back, more tests come back, the higher probability we'll get more positives. So a good start to the 3-day cycle. That's usually the most risk for us to have larger case days. But certainly 74 is a nice number. We are down nearly 1,400 active cases since last Thursday. I believe we are at 1,600. Let me check. Active cases. We are at 1,566 active cases. So again, in the beginning of January, we're at 6,000 active cases. Quite a comeback we've made. So that's very good. 2 of our 74 are related to senior facilities, and 1 of the case is a resident of a senior facility. When we look at hospital numbers, our hospital numbers are good and improving. 118 individuals are in the hospital. That's down from yesterday. 36 of our neighbors are in the ICU. I think that's up 1 from yesterday. So please keep those 36 residents in your prayers so that they can get better and return home to their families. Testing information, this is our best tool at preventing the spread, is to identify it quickly. Symptomatic testing, ongov.net/Cayuga Medical, Monday through Friday, 9 to 2 at the F-Shed at the regional market. Any symptoms, you need to get a test. You need to rule out COVID. If we do that, we'll continue to have success. Weekend symptomatic testing at Nescentia Health on 1050 West Genesee Street, 8 to 12, again, ongov.net/Cayuga Medical. This is our, if you look at where we've gone from positive rates, new cases, it's really remarkable. It's being noticed around the state. Almost 9% 30 days ago, now at 2.5%. Part of it is because we woke up as a community to the gatherings that were driving these numbers, but also the testing is key. You identify and you isolate, and then you quarantine the contacts. You limit the risk. By us doing this and everybody responding, but our community testing that we did really helped drive this in the right direction. So we know it works. We got to just keep it up. Asymptomatic community sites. Today we're in Onondaga Town Hall. Tomorrow we'll be at Lafayette Community Center. Monday back to East Syracuse Village Hall, and then we will update new sites next week. But you can go to ongov.net to register, and I'm sure we'll have new sites even probably set for next week tomorrow. Vaccine. Let's go through just kind of the basics here before we get into data. who qualifies for the vaccine? New York State sets who qualifies. There's been one exception related to qualifications so far, where the governor has given essentially your county government the ability to qualify, and we'll talk about that in a minute. When there is 3 sites, essentially, or 3 categories. There's 2 pods, one being the fairgrounds. They have an appointment schedule. Very difficult to get new appointments unless there's other cancellations. Then they open up new appointments. But regardless, thousands of people are being vaccinated at the fairgrounds every week. So that out of the eligibility, that means each week are those who are eligible for a shot, that number is going down due to the activity at the fairgrounds. A state-run pod staffed by county government, so a state-county partnership. Our pod here at the On-Center complex, we actually have new appointments each week because we'll only register appointments when we know we have vaccine in hand. That's how it's going to go. So the process then's a little chaotic, but there's really no other better way because we don't have the ability to register for weeks in advance because we don't know if we'll have vaccine. Pharmacies are receiving vaccine as well. Kinney Drugs has been a great partner. This week, Walgreens, I believe, is getting or has received vaccine that they previously weren't. Wegmans still receives some vaccines. So always check in with your local Walgreens or Wegmans now as some of their stores have gotten vaccine as well. So that's where the when is when the vaccine supply comes in, and the how is with those pods as well. And there's different registration processes for each site. And I know it's confusing and I know it's frustrating, but that's the way that the state has rolled this out to date. Our hope is that we are leaned on in a big way moving forward so that there's clear communications with new supply and where people can go. The vaccine, like I said, the governor's determined the eligibility with the caveat that next week, not this week, next week, if the local counties wanted to expand 1B to restaurant workers or taxi, Uber, Lyft drivers, we could. Although I've started to get some data, we do not have enough data to make that decision, so we will not be doing that next week. So if you're a restaurant worker or a Lyft or taxi driver right now for next week, meaning Wednesday to Wednesday of next week, you will not be eligible for the vaccine. I don't have a problem making this decision because we don't make any important decisions without the data. The data I do have suggests clearly that the most vulnerable and the most at risk for outcomes with this virus are our seniors and those who are immune compromised. The immune compromised are not yet eligible from New York State. Certainly, I think that will happen in the near future. Under 65, if you're over 65 and you work at a restaurant or you drive Lyft or anything, you are eligible right now. It's just under 65. And when you look at hospitalizations, you look at loss of life. We've lost 2 people under 30 during this process, 4 people under 40 out of our 611. Before people under 40 had severe existing conditions, severe. When you look at our hospital numbers under 35, I think we've had 6% of our hospitalizations have been under 35. So you look at who gets really sick with the virus, it is individuals who are over 65 for the most part, but over 50 when you want to keep on going down. So when you only have, when our goal is to crush this virus, protect our vulnerable, and our only tool is the vaccine, really, we need to prioritize. So we're not ready to go to restaurant workers. Again, we have to understand what restaurant workers mean. If you're a bar and you don't serve food, you're not a restaurant. So those are clarifications, too, that we've asked the state for as well to look at. Looking at vaccine data, let's talk about it. So we'll go through our pod, and then we'll go through data I know about Onondaga County in a minute here. We have administered 16,593 first doses so far. That does not include today. This is through yesterday. And 2,026 second doses. Again, on a second dose, we're going to email you your date and appointment time from COVID vaccinations. If you didn't provide an email, we're going to call you. And if you receive Moderna the first time, you need to get Moderna the second time. The vaccine data related to, before I give the overall data of what the breakdown, let me just remind, yesterday we had registration up. The 630 slots were filled in 15 minutes. The enhanced IT system helped. Nothing froze. It worked. But there were still thousands of disappointed people that they didn't get an appointment. That's a supply issue. So people found out quicker that they did not get the appointment that they wanted. And again, each week we go through this, we'll get more and more people through the process. We did have 2 pop-up clinics, Monday and Tuesday, and that's important because that has impacted our numbers positively related to equity. Partnership with New York State, they provided us vaccine. On Monday, 400 Syracuse Housing Authority residents and Centro staff were vaccinated. Yesterday, we vaccinated 600 new Americans and homeless shelter staff at Dr. Weeks School. That is very important. Equity is important in this process. Our goal is to make sure that we're vaccinating the same representation of population from sex, from ethnicity, from race, and in some hard-to-reach communities where there's language barriers, you need to do things differently. And we may need to do things differently when we continue to analyze about rural pop-up clinics as well, once we know more, have more time to analyze all the data. But let's go through it. We talked about how many first doses we've given and second doses. Onondaga County residents, this is data I received from the state of New York about a half hour ago. Onondaga County residents, we have about 465,000 residents. There's about 360,000 eligible adults to receive the vaccine. That does not mean you're eligible to get it, but that means you're an adult, 360,000 adults. If you're children right now, you have not been approved to receive the vaccine yet. So 52,085 county residents have received the vaccine to date. It's 11.3% of our total population and 14.4% of the available population. The state average is 7.6% per county. So we're doing better than other counties. This does not include the long-term care facilities in our county. So that number is likely closer to 60,000 than 52,000. This does include numbers if you went out of the area, say you go up to Potsdam to get a shot, you're included in this number. So our county essentially right now, over 15% at least of the available population when you include long-term care facilities. When you look at our specific data, this is the on-center, okay? What has the on-center been tasked with? Remember, we were getting redirected doses for healthcare workers to help the hospitals at first. Then 1B came on. 1B was your teachers, your law enforcement professionals, and your 75 and above. 1B the next day gets expanded to 65 and above. Then the next week, the state says 65 and above preference only at the pharmacies, and counties, you start focusing in on all the other 1B and 1A preference. That doesn't mean that seniors weren't getting the shots. But so our pod is actually probably the most representative when you look at the data for 1A, 1B seniors as far as capturing the type of data we're looking to. So out of 16,593 first doses in our pod, 33% are over 65, 17% are under 34. These are healthcare workers, education workers, first responders. 49% are between 35 and 64. To give you an idea, in our county, there's 69,000 people that are over 65 and above. So, you know, you're looking at about 30%, a little bit less than 30% of our county population is 65 and above. Our pod is vaccinated 33%. So more than what the representation is. Mind you, all your drugstores, and that's probably close to about 10,000 vaccines, are 100% 65 and above. When you look at race, 85% have been white. The population is 80. 7% have been African American. The population is 10.6. 2% have been Asian American. The population is 2.7. 1% being all other, 4% declined. All other, which does represent Latino and Hispanic, for the county population is 4%. So we don't know right now. It looks like we are underperforming in the Latino community, and it looks we still do have some work to do in the African American community as well. If we did not do those pop-up sites last week and this week, these numbers would be very bad. So it shows you that we are going to need to be intentional getting into neighborhoods moving forward. Ethnicity, 70% not Hispanic, 2% Hispanic, 17% other, 10% declined. By residents, 71% in the suburbs and rural communities. Again, I haven't seen the breakdown from zip codes for those 71%. Slightly above where our population is, 67% essentially, 68% is our population in the suburbs. 21% city of Syracuse, that is below where they should be. They should be about between 30 and 33%. And 8% are out-of-county residents, but central New York residents. That within the city zip codes, we are tracking those, and those will help us with pop-up locations moving forward. The 13208, your New American community, we did very well there yesterday. If we didn't have that data, it probably would have been very bad. So it shows you that this is going to be part of the playbook moving forward. Our on list is full. As we pull appointments from on list and do more, we'll leave that. We're going to give that time to work through so that it's the 10,000 folks get their opportunities to get their appointments. What we're seeing is many people that get on list still try to get other appointments, and they are. People are emailing us saying, I'm on list, I got another appointment, can you take me off? But again, we each week our partners are going to pull from this. Kinney's is committed to it. Obviously, we'll pull from it. We've asked the state fairgrounds to pull from it as well, and they just don't have new appointments yet. So that will be something that we can pull from, and we'll work through this list. But we did do a phone bank to fill the slots where people could call in and get an appointment that way as well, besides the registration process. But right now, we're not taking new folks onto that list yet. One of the other things that we are doing, though, again, we're working with industry leaders in the hospitality industry to get a sense of how many employees are we talking about when you're looking at restaurant workers. We've talked to the trade groups we've been working through. We'll ask them to work with their members to come up with some, names, so similar to like a pre-registration process. We're going to talk. We believe immunocompromised individuals are going to be next. When that is when we probably see the next bump in vaccine. So we'll start having conversations with primary care providers about putting together similar lists. So we have an idea, how many people are we talking about? And then as we can break down more of this data, we'll know how many teachers are left. We're going to have calls with teachers unions, ask them to reach out to their memberships. How many are left that want the vaccine? And we'll go through, and then we'll figure out how we can micro-target all of this as it comes in. It would be better if we just get a lot of vaccine, then we don't need to worry about it. But that's kind of where we are right now. We talked about libraries. Libraries we're gonna get them opened back up. Let me go through the details on that. This is for your city library and your branches. Here it is. I thought I lost my sheet. That would have been really on the fly if I lost this. That would have created chaos. So city libraries will be opening for in-person visits on Tuesday, February 16th. The libraries will be open from 10 to 4 for in-person service by appointment. You do have the ability to come if you don't have an appointment, but if the capacity constraints are full, you won't be allowed in. So please make an appointment. Central Library will be open Monday through Friday. Beach Up Library will be open from on Mondays, Wednesdays, and Fridays. Betts in the Valley, Tuesday and Thursday. Hazard, Tuesday and Thursday. Monday Branch, Monday, Wednesday, Friday. Payne, Tuesday and Thursday. Pettit, Monday, Wednesday, and Friday. Sewell, Tuesday and Thursday. And White on Monday, Wednesday, and Friday. The library staff came up with this schedule based off of users. The more busy libraries, 3 days a week. The other libraries, 2 days a week, appointment only. All visitors will be mandated to wear masks, temperature checked, and provide names and phone numbers for contact tracing. Space will be limited. There will be a certain number of appointments available. People will be able to use computers and read books, magazines, browse the collection, and ask for help from the library staff. There will not be story time right now, but trying to get services online as well. People can make appointments online, by phone, or in person with the space permitting. The library will start taking reservations on Monday, February 8th, so essentially a week in advance. Another thing that our health department is looking at right now, we're looking at school quarantines, potentially modifying some of the quarantine guidance specifically for high schools students. And there's been a lot of conversation with superintendents and parents about getting kids back in-person learning 5 days a week, or modifying the hybrid schedules to get them in-person learning more. We're talking with state officials about what that looks like. There's certain regulations that if you tweak them, make that very doable for some districts, and some of the superintendents have reached out to us and would like that to happen. So that's an ongoing conversation. I obviously believe in-person learning is the best way for a child to be learning personally. And I think where we're going as a community, and the robust testing we do in schools with the vaccinating of the employees proves that it's an appropriate time to have these conversations. Saying that, happy to take questions.
Ryan, do you know how many people are being vaccinated today between first and second doses?
I do. 630 first doses, over 1,000 second. Yeah, over 1,000 second doses. So today's our first real busy. I think 1,300 was our 1,400 was our max before. Today is a new new day for the pod, right? So the fairgrounds is going to be in the same boat, I think, next week, where you learn how you're doing your second doses, first doses at the same time, working through that. So I think tomorrow will be a busy day as well for us.
Are you concerned about the crowd upstairs? That you have the ability to space this out over more days?
Yeah, well, again, first day. They'll, you really, ideally you don't, because of when you want that second dose to be. You want to keep your 28 days if you can, or your 21. There's one day next week where we have a 28 and 21. For one day we had a Pfizer clinic. So you're gonna, right now I think, I haven't talked to the team yet. My understanding is that there are some people that are waiting to get in outside, and it's slower than it normally is. So I think we lucked out that it's 40 degrees and sunny outside. And certainly I'm sure tomorrow they'll be able to come inside. They could come in the building right now if they wanted to. But I think from the flow standpoint, it's not, the weather conditions allow people to stay with the normal flow. They could bring the flow back in through into the on-center portion where people traditionally wait for their test results if they wanted to.
Go ahead.
I'm just wondering, would it make sense not to do all 6:30 on the same day?
It really, you want to do is, when you have a clinic, Tim, you want to do as much as you can. It's more difficult to do a clinic of 100 people than it is 1,200 people, just with staffing. And so you want it's to break up new appointments into small increments like that. You prefer not to do that.
The data you gave us, in terms of population, is that just the Onondaga County pod, or does that include the fairgrounds, Kinney Drugs?
The 52,085 is everybody, and everybody in Onondaga County that has received a shot. So you could, anywhere you've gone in New York State, you're counted in that number. Our pod number is 16,593 first dose going into today. So when I broke out the specific data, that's from the 16,000. I do not have that level of data from pharmacies, fairgrounds, Potsdam, Marcy, Madison, Cayuga. Remember, 8% of ours are from other counties. My bet is, based off of where the state average and our average is, that other counties around us, their out-of-county vaccinations are probably much higher. Remember, our vaccination rate is 11.6% compared to the average of 7.5, state average 7.56. We're at 11.28. So we're much higher. Part of that is we're faster, and we're good at this, but that also means we're traveling to get the vaccine.
Do you get exact numbers from Kinney Drugs and Wegmans and all that on the number of
They're
doses?
in the 52,085.
Okay. They're just lumped.
Everybody's in that number.
Okay.
That's the total number. We'd be interested in that data to see the demographic breakdowns, but I think the trends are going to hold to what our pod was doing here without the micro-targeting efforts. The trends are that your minority communities so far will come get vaccinated if you go into those communities. Our regular pod, and before our 3 days of outreach, this data would look a lot different. So we know, we're learning this. My guess is the pharmacies are going to look very similar. They're going to have a high percentage of Caucasians. The fairgrounds probably the same. We're being very intentional, and we're going to need to be very intentional to make sure that communities get opportunity. What we're going to run into is distrust in the process, and then we're going to, that's where the education and the health equity task force is going to have to really push that process.
How do you get that data from the state? Are they willing to give it to you? Have you asked for it?
I have asked for it. They literally just gave me what I gave you 30 minutes ago. So eventually they'll get it and they'll break it down and they'll share it with us.
I know last week you were saying that law enforcement was lacking in the vaccination process. Do you have any update on that and how they're going compared to teachers or things like that?
No, we're doing more surveys, so I don't have an update on that. Again, I think we're gonna at some point with teachers. I think we're probably going to be in a position soon with our after we have our call with the unions and asking them to go tell us who hasn't. I think we're going to be in a position soon where that group is very close to being vaccinated. There might be individuals that want to get vaccinated, but for whatever reason they haven't yet, whether they had COVID, they're going to wait another 60 days, whatnot, or there's going to be some people, like everything, that just don't want the vaccine now. They want to see how it plays out. But I think that's really great participation from our healthcare workers and our education workers.
You like to tell stories behind numbers. If you look at the active case numbers on a chart, November is the beginning of a mountain. January, the first few days, is the top of the mountain. We're back on the bottom side of the mountain, about the same as right before Thanksgiving. What story do those numbers tell?
Yeah, I think our community, unfortunately, we learned from Thanksgiving. I think Thanksgiving was sobering after that when things started to really happen. And so the gatherings, we did much better, the gatherings during Hanukkah and Kwanzaa and Christmas, and then on New Year's, we did much better. Remember, the cases were growing over 100% per event, and up to 470, 490 cases. Actually 470 after Thanksgiving. It did get to 490 after Christmas, but the difference being you had 100% growth per event. You had minimal growth with the Christmas and New Year's. And then folks really dove in, did the right things to help us get these numbers down. And we continued to identify the virus after New Year's. We were really testing out in the community, trying to find it. And by finding it, you start the process to starve it. And so that's where we are. We always knew the virus would do better during the winter months anyways, and it still will. The 74 is a great number in my opinion. But we can keep pushing this thing low and keep it in this range. And then when our activities are more balanced with indoor and outdoor, I think with the vaccinations really helping as well, I think we'll really be in a good spot in the spring.
Do you worry about the variants resetting this cycle in March?
I think if you look at where the variants could play, right? So you have a lot of our young people have built up some level of immunity during this process, right? How long that lasts, doctors will debate. The key is vaccinating. You're vulnerable with the supply you have. So nothing suggests that the vaccine doesn't work with the variants. Actually, there's a lot of evidence that the Pfizer and the Moderna does work very well with the variants. So then you go down to if your younger population, which has been where the cases have been spreading for the most part, then gets this virus, the variants aren't as, at least there isn't evidence at this point that it's a stronger virus. So then you look at the data, how many people under 35, under 40 turn into hospitalizations in those demographics. And it's not many. I think it's 2% in the 20 to 29 and then 30 to 39. So I think the key here is to get your vulnerable vaccinated. And that, if we're worried about the variants, that needs to be our job. And so at least that's where we want to be. And that's where we're advocating for us to be, is let's really, if this is going to be a problem and we start to detect the variants and that's starting to become the strain, there should not be a senior or an immune-compromised individual that is not given priority. And that's our belief and will continue to be our belief.
What conversations have you had with the state about getting immunocompromised on that list?
I think the state is going to move on it. I think the reality is right now, and it's a tough spot to be in, is becoming eligible means you're eligible. That doesn't mean you're going to get a vaccine. And so when you look at, for us, each week we go through a process, and we know after we have our registration link, there will be thousands of phone calls and emails with disappointed people. So creating eligibility creates that until you have capacity to deal with the eligible population. So it's a balancing act, and I don't know. We're trying to figure out, based off of the severe immunocompromised diseases, how many county residents is that? Is that 3,000? Is that 4? Is that 5? I don't know. So what kind of stress are we putting on a stressed system already? Restaurant workers, taxi drivers, same thing. Right now, if you're eligible, which you're not yet in Onondaga County, that doesn't mean you're getting a vaccine tomorrow. There's no slots, right? So then we look at the data, we look at the demographics in that workforce. They don't, those demographics predominantly that dominate that workforce don't get as sick. That's just the data. That's the stats. And I know there's some business owners that are very upset with me that they're not eligible yet. But I apologize. I want you to get your vaccine. But I think seniors should be getting it first.
We've heard from a couple of people who jumped the gun when the governor opened up that 1B eligibility to restaurant workers and taxi drivers, and were able to get an appointment by clicking like essential worker or whatever. Will they be able to get the vaccine or when they show up, or is that do you know how that's
So
gonna
you're
work?
suggesting they lied. They're doing something they shouldn't be doing.
Okay.
If they do that, they got to sleep at night with their own
But
conscience.
there's not going to be a check when you get to the vaccine. Is
What are we supposed to do?
okay.
Yeah, I mean, they should not do that. That's not a good thing to do. But again, there's fraud in everything that happens, right? So I'm sure if someone's going to do that, I don't know what the repercussions would be. I don't know what the state law is, but certainly it's not the right thing to do. If we had enough vaccine, I'd just have everybody get in line. We would set it up where we got through 460,000 people, 360,000 eligible people, and we would do it very quickly. We just don't. And you ask questions about variants. You ask question about who died today. Everybody who died today fits the model that I'm talking about. These are the people that if they have the vaccine, they're not going to die. And that's what this is about. That this is the tool to stop the death and to stop the hospitalizations, and we need to give it to the people that fit those brackets first. And I apologize to everybody else who's not in those brackets yet. We're going to get to you too. I want to get to everybody.
I'm sure you get the same emails we get from people with compromised immune systems who have very compelling, sad stories about why they want the vaccine today. I spoke with a woman from Camillus yesterday who said, I get what the governor is saying about doubling the number of people eligible and adding anxiety and adding stress to the reservation system. She says, that's okay with me. I just want to be able to refresh the computer and try. What do you say to those people who really just, they want to go?
I understand. I probably talked to him. I think I talked to who you interviewed at different points. Yeah, I get it. I get it. We will never be in a position where we have vaccine that we're sitting on, and if we get more, we'll be open Saturdays and Sundays and longer hours, right? So we want to get to everybody. This is the tool for people to get their lives back, especially those who've been sick. I think the individual you interviewed, it's not just her that's been impacted, or her family's scared to go do things. It's horrible. It's horrible. We want to get to them. And again, they should be going. They will have a bad outcome. So our where we stand, and if this was my call, which a lot of this isn't, is our seniors and our immune compromised get vaccinated first, because that's going to save lives, and we'll get to everybody.
Do you have any indication of what your allotment will be next week?
No, not yet. My guess is it's not going to be much better than what I had this week, but who knows? If there's new, again, if there's new every week, it's frustrating, Tim. But every week, there are more appointments. There's already appointments that are being vaccinated, right? So our total number of eligibility goes down each week. 52 is going to be higher next week. It's just when you know Dr. Gupta and her team are very good at this, and they can do a lot more. I have 180 nurses that we brought on part-time. We could do an amazing amount of vaccinating. And so we kind of worked, we anticipated to be much busier than we are right now. And again, quite frankly, you're asking me about data, Trish. I could give you all the data if I was doing all the vaccinating, but I'm not. So these are all things that when you decentralize that process, it's tougher to go and micro-target. It's tougher to realize how big are your equity issues, where all the gaps are. Because I don't know, we've done about a third, little less than a third of the vaccines. And I don't know who these other people are. I know a lot of them are seniors, which is really good. And I know they qualify in these groups. But when you look at inequity, I don't know how big our problem is with African-American community right now. I know where it is with our pod, but I don't know what the whole macro picture looks like.
What do you say to the restaurant owners who really feel like you should take up the governor's offer and start getting them in for shots next week?
Yeah, I talk to the restaurant owners, talk to me every week. So I have not heard from many of the restaurant owners that they feel their employees are more at risk to a bad outcome than seniors or immune-compromised people. I've not heard someone say that or suggest that. Maybe one person. But so we talked to the restaurant owners all week long. We advocated and got the zone change, state policy change for restaurants. We've given loans, hundreds of thousands of dollars of loans to restaurants and work with them on a daily, if not weekly basis to keep them operating. This is about, at this point, this is the tool we have to save lives. Are your employees the most at risk? If they're over 65, we think they qualify. If they're young, my age or younger, they're not the most at risk to being in the hospital or dying. The data says that, and we've been doing this for a year.
We heard from New York's federal delegation in the Senate, Schumer and Gillibrand, about money that Onondaga County will get directly through FEMA. Wondering, is that a new pot of money you're getting, or
No.
is that just kind of a good news a few weeks
Yeah,
after
it's
right now?
nice because we've spent that money. We're going to get reimbursed 75% of, so I think we get a little bit over $5 million back. There's talk that maybe we can get 100% reimbursement. That would be excellent news. So at least the money we spent for a lot of the pandemic response, not everything you spend is FEMA eligible. So our continuity of care program, our continuity of food program we did last spring, those are all costs that didn't get reimbursed, but that makes us a little bit whole for some of these costs. So it's welcome. Senator Schumer's been a great advocate and a great partner, and he's in a great position now to be able to help us moving forward.
Do you know what triggered that money, though? Was it Biden taking office?
No, that would have been done no matter who the president was. That was 75% reimbursement. The difference is President Biden is suggesting he's going to do 100% reimbursement. We don't know if that's going backwards or moving forward related to costs. So
It was money you expected the whole time.
we did, and I think we're one of the first counties to actually get approved for the process. So my finance team did a really nice job with that. They made sure to let me know that they think they were the first county to get it done.
Is that from the application last summer for the cost through May?
Correct.
Why did it take so long?
You're asking the wrong guy there. But yeah, I've heard other county executives have told me I would have waited a lot longer for it. They were still waiting on some flood relief money from a couple years ago. So
So you should have more FEMA money in the future.
I would hope our costs moving forward related to the pandemic will be covered at least at the 75% level, hopefully the 100% level.
Syracuse University just released their lacrosse schedule. Do you have any update on getting fans into the dome?
Yeah, I talked to the state. I think the proposal has been put forward related to students for basketball and general population for lacrosse. And I've asked the state to expedite their review process so that this can hopefully happen sooner. They took the Buffalo Bills model, right? So they took a model that was already been approved. We know that they're doing a lot of testing there. It gives the students something to do. It gives them, an experience that they've been, it's been stolen from them. And so I think it's actually helpful for the pandemic to, if you test and quarantine these students and then the next day they go to a game, specifically if it's a weekend game, that means they might behave on a Friday night. I think that's a positive.
Are you already planning for more pop-up clinics? How often are those going to happen?
Yeah, so these have been from the state's vaccine allotments. So very successful yesterday, very successful Monday. We did it at AME Zion the previous week with Pastor Jaime, who did a great job. So we want to continue to do this. And so the state will let us know if they have available vaccine to do some of this next week as well. But the equity numbers are being driven by these pop-up sites. Without these pop-up sites, these numbers would have been scary. And if you think the On Center is not far away from our predominantly minority communities at all. It's very close. It just shows you that there's a level of distrust. But if we're there and people are going and they see their neighbors going, we saw that happen at Toomey Abbott. So it was good. But
That's going to be a separate stream of supply?
Correct.
Every week you're given a new number with your vaccine doses, and you're hearing from the governor about more vaccine opportunities here, and then the Biden administration is sending a higher percentage of doses there. What's it like to monitor this incoming information from different levels of government? You're dealing with the people who are eligible, reservations, staffing. I mean, this just must be a monster project.
It is. I got a great team. The easy part is doing the vaccinating. The planning and getting people and figuring out the most equitable way to get people appointments is a challenge, because the reality is we're in a situation that is impossible. And so a day in the life of registration day is you have the registration. It's done in 10 or 15 minutes. Yesterday, the technology worked well. We spent a lot of money for it to work well, so that was a win. What wasn't a win was all the disappointed people. And then, unfortunately, some people get very disappointed, and then my staff, who's been on the front lines this whole time, deals with a lot of angry phone calls and some inappropriate phone calls. And we have, a lot of email correspondence. I'm emailing a lot of people. And again, this is part of the process, and this is the way it is during the vaccine. And until the supply is enough where I think there can be a commitment for county governments to have a certain amount of supply so we can register 3 days a week and start taking appointments to get through these eligible populations, I think this is just going to be what it is. Remember where we were with supply, okay? 300,000 the state was getting. We were getting 3,600 doses. The hospitals were getting doses. The hospitals recognized we could do it faster. They would redirect their doses to us. So we were actually doing more like 5,000, 6,000 shots. The state got cut to 250. What happened was the hospitals got 0, so that was part of our supply, and they continue to get 0. And we got a 75% cut. So if the state now is saying I'm getting 10% more, they got brought back to 300,000. But that 75% cut didn't get restored to us. They either gave it to different points of distribution or to the fairgrounds. So when they say a 10% increase, if you're giving me a 10% increase from 1,200, that is not moving the needle. We're getting, more people vaccinated. The governor said 20%. That's good. That's 20% of 1,200, still about an extra 240 a week. So it's small progress, but we really need to be brought back to the levels where we were when they were at 300,000 the first time. And my concern moving forward is more points of distribution. You want to talk about what's driving the anxiety here is people having to go to various outlets to try to get an appointment. To bring on more points of distribution is just going to exacerbate that. So there should be no more points of distribution until the fairgrounds is doing 18,000 a week, the On Center is doing 18,000 a week, and probably Shopping Town Mall is doing 18,000 a week. After that, then we got to go figure out what communities we're missing, and then you have different points of distribution where you're micro-targeting.
How much did it cost you to bolster the website?
I don't got the final number yet, but I think it's between $15,000 and $50,000. Hopefully FEMA reimbursable.
It's a pretty big range.
Again, if you knew what my days were like, this is like on a weekly to-do list. How much did that cost? You just get it done, and then you figure it out. What it was.
Minimum $15,000.
A minimum of $15,000.
Just for the website.
Well, servers, more data points.
But just to solve the website problem.
Just to make sure that what happened the previous week didn't happen again.
You know how Onondaga's doing compared to other counties? We have about 15% of eligible people vaccinated now.
Yeah, so you look at so again, our based off of population is 11.28. The state average is 7.56, so we're much better than the state average. In discussions, again, this wasn't confirmed. I haven't seen it, but in my discussions, it was referenced that we may be the largest, doing the best out of the large counties. When you look at percentages, it wasn't confirmed, but we're doing well. I mean, if you look at every time the governor updates on first doses, second doses, we're 98, 100%, leading the state, and it's we're getting it done. Any questions? Okay, Super Bowl Sunday, big time trap weekend for COVID. The two best football teams in the NFL aren't playing, the Bills and the Green Bay Packers. So if you watch the game, and that's a big if because it's probably going to be a boring game. But if you do watch it, you please, the indoor gatherings at your homes, remember this is what got us into this mess. Certainly some of the commercial establishments, in my opinion, are probably safer if they're following the rules. So let's not fall into a trap with the Super Bowl, which should have been a Packers-Bills Super Bowl. So if you're going to watch it, probably a boring game, but if you're going to watch it, please be careful with the indoor gatherings. I think this is a trap type setting, perfect setting for COVID to spread indoors, no mask wearing and whatnot. So please be careful, stick to your pods, and we'll continue to drive this data down. And we'll be talking about more and more things about getting our lives back. Talk about kids going back into the classroom more. Talk about weddings potentially happening with testing. All the things that people are talking about. How we do that is we keep this virus at bay. So please be safe and have a great weekend.